Project 2025 is a proposal that seeks to dismantle America's system of checks and balances in order to advance an extreme far-right agenda that would negatively impact all Americans. The plan aims to reduce the power of everyday people, shifting it toward politicians, judges, and corporations, giving them greater control over people's lives. Below are the specific ways Project 2025 could harm residents of Idaho. Taxes. Project 2025 shifts the tax burden from the wealthy to the middle class. Under the plan, a typical family of four in Idaho would face a tax increase of $2,639 per year, while 45,000 households in the U.S. earning over $10 million would receive an average annual tax cut of at least $1.5 million. Social Security. The authors of Project 2025 support raising the retirement age, which would impact about 75% of Idaho residents, around 1,448,117 people. This idea is reflected in the two most recent Republican Study Committee budget proposals, which suggest raising the retirement age for Social Security from 67 to 69. This change would reduce benefits by $4,100 to $8,900 in the first year. Depending on when Social Security is claimed, a median wage retiree could lose between $46.00 and $100.00 over the course of 10 years. Healthcare. Project 2025 proposes imposing lifetime limits or caps on Medicaid benefits, putting 180,300 low-income Medicaid enrollees in Idaho at risk of losing their coverage. The plan also eliminates out-of-pocket limits for Medicare prescription drugs, increasing costs for up to 80,160 people in Idaho. In addition, it blocks the government from negotiating lower drug prices, abortion rights, and contraception. Project 2025 would remove some emergency contraception medications from free preventive care, meaning 190,000 women in Idaho would lose guaranteed access to free emergency contraception. The plan directs the U.S. Department of Justice to misapply the Comstock Act laws from 1873 and 1909 to criminalize the mailing of medication abortions, effectively instituting a nationwide abortion ban, even in states where abortion remains legal. It also directs the Department of Justice to take legal action against local officials who refuse to prosecute women and doctors who violate state abortion bans, including Idaho's own law. Child care. Project 2025 calls for eliminating the Head Start program, which currently provides no-cost child care and other services to 3,560 for low-income children in Idaho. This would eliminate a crucial child care resource in rural and underserved areas that are already facing a shortage of child care slots. Student loans. The plan replaces income-driven repayment IDEA programs with a single, one-size-fits-all system, increasing payments for borrowers currently enrolled in IDEA plans, including those in the Biden-Harris administration saving on a valuable education save plan. Public education. Project 2025 proposes eliminating the U.S. Department of Education and ending Title I funding, which provides additional resources to schools that serve low-income students. Without Title I, Idaho would lose 761 teaching positions, affecting 13,313 students. Project 2025 presents a radical shift in policy that would have significant negative consequences for vulnerable communities, particularly in Idaho.